Hello and welcome to Wired In. I'm Diana Galata with Hampton City Schools. I'm very pleased today to be joined by a friend, Nancy Lemis. Welcome.
Thank you for having me. I appreciate it.
So you are the district epidemiologist for the Virginia Department of Health. That's a mouthful.
Yes, it is.
So tell us a little bit what you do on a daily basis.
I am the epidemiologist for the city of Hampton. What I do is I investigate communicable diseases that are reported to the city of Hampton. Wherever you live is where any disease that you're reported is counted at. So that's what morbidity is. So if you get sick and are seen in the hospital and they diagnose you with a foodborne illness or a kind of pneumonia that is unusual, then that would be reported to us. And then where you live, if you didn't live in Hampton, say you went to one of our hospitals and you didn't live in Hampton, we would send that information to whichever city you live. And then they would do any kind of follow-up if there's anything necessary. So it's really busy. It can be, it's kind of sometimes not busy, sometimes it is, depending on what's going on. Right now we're getting ready to go in flu and noro season, so that's going to be speeding up our job a little bit, following up on everybody.
So obviously you have a large role to play in terms of preventing infection, preventing the spread of disease. And so the end of October is International Infection Prevention Week.
Yes.
So tell us a little bit about that and your role in preventing infection and the spread of disease.
We're trying to get the message out to the community that it's very, very important that you do what you can to help stop the spread. The most important thing anybody can do is to wash your hands. You never can wash them too much. And when you wash them, you want to take about 20 seconds. You really want to get that friction and get all parts of your hands and not just the little palms. You want to make sure you use soap and water, and the friction is really going to get those germs off. And it's important that you do it correctly, and it's also important that you do it before meals, after meals. You want to do it if you're petting an animal. And if you've been playing outside, or if they're just visibly dirty, you would want to wash your hands. And that's going to be your biggest benefit to help yourself, because your hands touch everything. And then all of us at some point put your hands in your face, and you can spread those germs from your hands to your face, and then you can become ill.
So what are your thoughts on the antibacterial pumps that you can, because I know some people instead of washing their hands will just use that, and I'm guessing you don't recommend that.
You can use the sanitizers. We prefer that they be clear, not colored. We want them to have a good alcohol base. Usually about 63% is good. When you can get to soap and water, you want to do that, but when you can't, you want to have the sanitizer available in your car. It's really good, in your purse, just so that if you're not where there is soap and water, you do need to wash your hands. Because if you go through a drive-through, how many of us reach in the bag and get French fries before you get home? So while you're waiting, just use your sanitizer, and then your hands will be clean enough so when you're eating, you're not passing those germs.
So back to the hand washing, I'm assuming that the recommendation is warm water as opposed to cold water, or does it really matter?
They do like warm water, but it's the friction. That's the most important. You really want to get that friction to get the germs off your hands. And when you rinse, you want to hold them down so that all the dirty's going down and not holding them up where it can run down your arms. And when you wash, you want to wash all the way to your wrist, because you can touch yourself and then you can spread those germs. So it's just the friction is the most important part. It's very important if you go to your doctor and you get prescribed an antibiotic that it's usually for some kind of bacterial infection. Antibiotics do not take care of colds or viruses. They only take care of infections. So if you go to the doctor and he gives you, say you have strep throat, he gives you an antibiotic and he tells you to take it for 10 days. You need to complete the 10 days. You're going to start feeling better before the 10 days is over, but don't stop when you feel better. You need to make sure you finish out the course. If for some reason the doctor decides you need a different antibiotic and needs you to stop the first one, then discard whatever's left. You don't want to keep them for another infection later on. You want to make sure that you complete the amount of pills for whichever infection you have, because that's going to make sure that the germ is killed inside of you.
Perfect. So what else about infection, preventing the spread of infection? Is there anything else that's a key message that you might want to share?
Sure. If you need to cough or sneeze, make sure that you do it in your sleeve. Make sure that if you are around people who do have coughs, and I'll be very conscious of not getting up in their face, because you can, if there's certain diseases that are cough or sneeze, that spray that we don't see in the air that's out there could get into your nose or throat, and that's how we spread colds and viruses, especially during the season that's coming up. You also want to make sure that you can prevent yourself by getting all of your vaccines that are recommended. This time of year, especially for elderly and really young children, you want to get your flu shot. And a lot of people are really scared to get their flu shot because they say that the flu shot is going to make me sick. The flu shot is not going to make you sick. It'll take 2 weeks, and then it's going to help protect you. So if you are around anybody and get those germs, it will protect you. But the vaccine itself is not going to give you illness. If you feel a little rundown after you've had the vaccine, it could be that you were exposed to something prior to getting your shot, or it could be if your arm gets a little red or you just feel a little tired. That's just letting us know that the vaccine is working. It's building those antibodies against whatever germs it's there to do. So it takes about 2 weeks to get to working up to the proper. And for elderly, sometimes it's not quite as good as for a younger person because their immune systems aren't as good. So everybody should have a flu shot, 6 months and over.
And these days you can get one almost anywhere.
Yes, you can.
The drugstore, anywhere. So it's not like it's not convenient. I just know some people don't like the needles. And there is that thought out there that, well, if I get a flu shot, that will give me the flu. And I will say personally that I've had a flu shot for many, many years and I've never gotten the flu. So it really does work.
Yes, it does. And we have normal, healthy Americans that die from flu every year. So we want to prevent that as much as possible, because that is not one of the investigations, especially for children, that I like to do, is having to call parents. And the first question, if their child has passed, the first question is, did your child take a flu shot? So it's very important anybody 6 months and over get their flu vaccine.
Very important. Well, thank you very much for joining us today and helping spread the word. And hopefully it will help keep people well this season. And hopefully you'll come back next spring and share some more tips with us as we get into summer and fall.
Yep. Just everybody remember to wash your hands.
Thank you.
Thank you.
And thank you for watching Wired In. Have a great week. Thank you.